the pharmacy on Today, sponsored by Boots.
Now, as all parents will know, being a new parent, it can be both exciting but really daunting, I suppose, because there's a lot to learn by the minute.
Here to offer some advice for new moms and dads, we have pharmacists with Boots. We have Heather Feeney. Heather, great to have you on the show, as always. Can we start with vitamin D? Very, very important, isn't it?
Very important. So as you'll know, vitamin D is one of the building blocks for bones and maintaining healthy teeth. So especially in infants and babies from that 0 to 12 months, which are the real formative months. I know babies double in size between 0 and 5 months. So really, really rapid growth. Really important to have all those right precursors, and vitamin D being one of the most important.
So you start vitamin D straight away, the minute they're born?
Well, it's dependent. So if the baby is breastfed, you're to supplement vitamin D. So it's recommended by the HSE that a baby would take 5 micrograms per day, and that can be given on the nipple or can be given directly into the baby's mouth. And then if the baby is taking less than 300 mils of formula a day, so that's if someone maybe is doing breastfeeding with the odd bottle in between, then the baby would require vitamin D supplementation. But if the baby is fully formula fed, those formulas are fortified with vitamin D, so they'll be getting the vitamin D
So
from
you have to be careful there. You have to know what you're giving them, really, in one sense, don't you?
In a sense, but I think the kind of rule of thumb is if a baby is breastfed or taking less than 300 mils per day, vitamin D supplementation.
That's really interesting. I don't know if a lot of people realise that. And if you have a baby that's formula fed, if you do give extra vitamin D, it's not going to do them any damage. Just let people
know. So the
know.
recommended daily allowance within the from the Food Safety Authority would be up to 25 micrograms per day. So no, it's very unlikely you do any harm, but still important to try and keep within those guidelines.
To realise, actually.
It's just a powder, is it, Heather?
It's a little drop.
It's actually a little drop.
Oh.
Yeah,
it's the second one in there, the little blue one
so
there.
it's a pump. So we'd recommend generally that you wash your hands, obviously with our lovely hygiene guidelines, and then pop the vitamin D directly into the mouth, just in case the pump, just the actuation of it would hurt the baby's lip or anything. But other than that, it can go into the feed or onto the nipple if the baby's breastfed.
Yeah, and when you're buying it in the shop as well, just to be sure to look at the package as well for age and age appropriateness and everything.
Totally, yeah. Always really important to read the package, and if you have any queries, you can consult with your pharmacist or anyone in the store.
Yeah, and of course the vitamin D that comes in these drops, whatever, they're just vitamin D. There wouldn't be any extra vitamins added for newborns, and they'd be told like that. Now, that's vitamin D taken and continued on, I suppose. You can actually, what age would you get the supplement a little bit higher? What age would you add to that?
So it's recommended as far as 1 year that you have that daily dose if the baby is breastfed, but then from age 1 to 4, it's recommended that children will get a vitamin D supplement. They say from Halloween as far as St. Patrick's Day, so for those kind of colder winter months where kids aren't getting exposed to sunlight to generate natural vitamin D, supplementation is recommended then as well, and it's the 5 micrograms per day.
There are parents at home now watching this, Heather, and they're saying, yeah, vitamin D, that's all well and good, but that's not going to be one of the problems when a new baby comes along. What about reflux?
Yeah, reflux.
We want to solve some of the problems here now.
Yeah, so reflux is when kind of acids or some contents of the stomach leak up into the mouth. So it's not necessarily vomiting or anything. I think we'd know it more commonly in adults as a bit of heartburn. But in a baby, obviously their esophagus is still developing. And those muscles that close your esophagus, so that kind of keep the stomach contents in, they're not fully developed. So generally for around 8 weeks onwards, until that kind of muscle has developed, babies can have a little bit of leakage into the mouth. And you'll know it if they're kind of struggling with a little bit of a feed, or if they get hiccups, if they're getting a bit of a cough after the feed. Sometimes they might get a little bit, like they might tear up a little bit during the feed and afterwards if they're experiencing reflux.
What's the difference in colic and reflux?
So reflux is that leakage into the mouth, whereas colic is persistent crying. So colic actually doesn't necessarily have the same association with feeding. Now, colic, the symptoms or the causes for colic are actually unknown, but there can be a bit of an association with gas. So with colic, you'll see things like winding being recommended and massaging the baby's tummy outside of feeding times. Whereas with reflux, it's more that leakage towards the mouth, and it's more, I suppose, it's less concerning in a sense, because as long as the baby is still gaining weight and maintaining a healthy weight, you're less concerned with reflux.
But when you're talking about reflux, you're saying it's leakage into the mouth. Can they throw up with reflux as well?
They can, and that would probably be a bit of a flag sign. So it's obviously not uncommon that a baby will throw up a little bit of a feed every now and again, but if your baby is persistently vomiting, that would be a warning sign.
Can you give baby anything for reflux, can you?
You can, so there's various different things that can be recommended. So things like Gaviscon if the baby is particularly suffering with it, or else you can attend your GP if a baby is really not holding down feeds, if they're not gaining weight. They can prescribe different kind of medicines that will help deal with reflux.
Almost like we take ourselves.
Yeah.
Exactly.
But a small bit, you wouldn't take much notice of that really, would you? Just a small bit of reflux. That's normal in one sense.
No, really normal for babies to be spitting up. It's just while that muscle is developing.
And when they develop those muscles, what age is it normally by, and when should you expect reflux to stop?
You'd probably expect it to stop between 4 and 6 months. So it's not something that should go on for very long. But as I said, as long as the baby is maintaining and keeping a healthy weight.
Even if they are.
And with colic then as well.
You've got something there for colic too.
Yeah.
Yeah, we do. So that's a simeticone drop. So basically...
The little red box, yeah.
So colic, the causes for colic are actually unknown, but you'll know that it's characterised by persistent episodes of crying.
Oh, that's Infocol. I've used some of these.
Yeah.
As probably everyone has tried
seems to
everything
go
if they're
on
a bit
forever.
colicky.
Yeah, it can go on
It
for
can
a
be
long
really tough
time.
on parents, Heather, can't it?
Really distressing, yeah, because when your baby can't settle, and I think the characterisation of colic is periods of 3 hours per day or more crying for 3 days per week, up for a
That's a
period
long
over 3
time.
weeks. It's a lot of crying, yeah, and it's a lot of upset for the
Can
baby.
they pass blood if they have diarrhea? Can these things happen as well to a child when they're
They
developing?
can. Now, if a baby is passing blood by diarrhoea or if there's blood in the vomit, you would want to talk to your GP. So it wouldn't be necessarily that common. So there's quite a lot of kind of common ailments, but our warning signs would ever be if a baby's not maintaining a healthy weight, if a baby's losing weight, or if they're passing blood.
You should go.
Yeah, you
Mums and
contact
dads will always know best anyway. They'll know what to do, won't they?
Yeah. And I think
If you
people are
don't
so
call
careful.
someone up or go to
Yeah.
the doctor.
That's it. The really important thing to remember is it's a really daunting time, but there's so much support out there between your pharmacist, public health nurse, GP, so just to avail of all the supports that are available
And the
to
public
you.
health nurses are coming
They're
to the house.
fantastic.
They really
They're
are.
brilliant.
Amazing.
They're
Now,
absolutely
cradle
brilliant.
cap, I suppose we're moving on slightly a little bit further on. And I mean, this can go on until kids are a couple of years old. Cradle cap, it's almost, I'm not saying it's like dandruff, but it's almost like dry skin on the head.
It's exactly what it is. So it's
Yeah.
like dry, flaky skin on the head, then mixing with the body's natural oils. So it often takes kind of a yellow colour because
Yeah.
of those oils. Now, saying that, it can be a little bit unsightly, but it does tend to resolve itself.
So it looks worse than what it really is.
Looks
Heather, is it?
worse, yeah. So all babies are beautiful, but yeah, it's
What
not.
causes it, Heather?
So basically, sorry, was that?
What causes it? Do we know why some kids get it and some don't?
Not necessarily. Some people have more sensitive skin, some people have more dry skin. So it's essentially just dry skin and natural oils. But it's really normal that it would occur between naught, so just birth, and then up to 3 months, can go on to 2 years onward. But then past that, you're probably looking at more skin conditions like your eczema, psoriasis, or more persistent dry skin. So important to consult on that.
Heather, one
Actually,
more.
on that though, can I just ask, just on that, when do you realise that your child may suffer from a skin condition? Is it around the 2 years of age?
Yeah, so it's really common in babies up to about 3 to 6 months. They have such sensitive skin, like things like dry skin. At that point, it's very difficult to tell if it's going to be a persistent problem. But past 6 months, if a child still has a lot of skin issues, it could be a sign, or else if their parents have suffered from them previously, or if you've had other babies in the house.
Sticking with the skin, nappy rash on the other side.
Oh, it's an awful, poor little thing.
It's a right old dose, isn't it?
Yeah, and look, there's very little that you can do about it in the sense that babies need to go to the toilet and nappies aren't always the cleanest environment. But in terms of things that you can do, it's trying to change the nappy as often as possible. Sometimes looking at the fit of the nappy because it's uncomfortable. If there is uncomfortable, it can be leading to kind of chafing and things like
Maybe
that.
even different brands of nappies as well.
Yeah, and just if you can also give the baby a little bit of time outside of the nappy. So not always the most practical thing, but that air on the baby's bottom can
Bit
be
of
really
freewheeling.
helpful. Bit of freewheeling.
Can I ask you, just on nappy rash, should you change formula if there is persistent nappy rash if you're formula feeding a child, or does that have anything to do with it?
It can do. So it would depend on what the baby is passing. So if the baby has persistent diarrhea that's causing that really moist environment in the nappy that's leading to nappy rash, you might want to look at the feeds, but we do always recommend that if you are changing feed, you consult with your pharmacist or public health nurse, have a bit of a chat around it first, and don't just change feeds willy-nilly because that can lead to
Well, there's
other
loads
problems
as well, isn't there, in the
Loads and
pharmacy?
loads.
You can get an awful lot of over-the-counter,
And they're
topical
brilliant. They're
creams
brilliant. They're brilliant.
and all that
and
as
your
well.
pharmacy will always help you, Heather, as well,
Yeah,
which is great.
They will, of course.
Thanks so much, Heather.
Thanks,
Great to
Heather.
have you with us as well. Now, if you have any other health concerns, consult your GP, as Heather said there. And if you want more information on what we chatted about today in studio, pop onto our Facebook page, RTE Today.
The Pharmacy on Today. Sponsored by Boots.